Hello and welcome to this web series dedicated to sharing tools and technical assistance developed alongside California counties between fall of 2025 and summer of 2026. Today, we'll be talking about unlocking federal match through culture. We'll be focusing on how to use the toolkit and materials in this session. There are a few sections that we need to keep in mind here. The first of which is the overview, marked with a blue star in the corner, to understand the general framing behind why we might want to use culture as a lever to help incentivize behavioral health departments to focus more on optimizing FFP drawdown. The next section will be activation, how to use a high-level calendar on what steps very tactically need to be made throughout the process and when they may land during a 12-month cycle. This, of course, can be adjusted to any 12 months in a calendar year per specific county needs. Lastly, we will run through how you may use some of the materials in this section to tailor them to county-specific context. So we are going to walk through informal interactions, communications, phrases, and things that can be used in more formal settings like a town hall for leaders to use to communicate things throughout the entire department. Now, of course, every department is a little bit different. And so it's important to note that this section being named Tailor, the intention is that the materials within this section are tailored to meet the needs of a specific county context. Just walking through the table of contents here. And we always want to start with the why when it comes to these tools and technical assistance. I think with this one specifically, there is a more indirect tie to the why. But of course, when we talk about culture, a culture promotes optimizing federal financial participation when everybody involved, from the frontline staff all the way up to the director level, equally value and see the connection between FFP and its ability to sustain and expand services for the most vulnerable populations. So this toolkit is designed to equip county behavioral health leaders with frameworks and tools to promote those positive staff behaviors with regards to optimizing FFP drawdown. In a high-performance culture, behavioral health leaders and staff understand how revenue streams like FFP support quality services for as many clients as possible. Now, what do we mean by this? Well, if we take our attention to the left-hand side of the page, federal match dollars multiply the impact of county behavioral health departments by a few key things. And what's really interesting is that when folks are able to tie this funding source to the multiplication effect that it may have on the direct services that they give to the folks who are the most vulnerable, is when you can truly see a culture of FFP being very strong within a department. So the first thing here on the left-hand side, sustaining current services amidst policy-related funding uncertainty. Being able to recognize that this is an extremely crucial funding source, one that folks have a lot of control over in terms of their delivery of service, their documentation of service. These are things that can help sustain county departments during policy uncertainty. Number two, expanding access to more clients. Most folks get into this work to take care of vulnerable populations. By expanding funding, you are able to, in turn, expand access to these services to a greater proportion of the population that you are already serving. The third one here on the left-hand side, ensuring high quality service delivery. Ensuring that there is fiscal health within a behavioral health department will maximize the quality of service delivery by being able to maintain all of the things that go into providing high quality services to those in need. Now, if we take our attention to the right-hand side, these are some examples of behaviors and values that you may observe in a county behavioral health department that already has a strong culture of FFP. And so you may recognize that some of these five, maybe all of these five, are things that you are already starting to see in your department.
And if not, these are some things that you can start to look for in your department, whether it just be in a particular program, a particular clinic, or even particular individuals, right? I think champions for change are one of the best ways to be able to promote culture. And so, as much as you can recognize these behaviors, is a really important and impactful way that you can take those desired behaviors and then showcase them so that other folks can follow their lead. So, number one, staff believe the mission to provide care includes unlocking funds through claiming federal match. I think most folks recognize that the direct service component is an extremely important piece to providing care. And another important piece to providing care is appropriately documenting the services and then claiming for eligible services such that you can receive reimbursement for those FFP eligible services. Number two, staff understand that their daily actions influence the fiscal health of the department and client access to services. And so this one is when even your frontline staff recognize that their daily actions actually have a meaningful impact on how the department is sustainably funded. When folks recognize that they have the the impact that they do on the financial health of a department, you'll oftentimes see that these individuals take more ownership over these actions because they recognize that being able to sustain the health of the department connects directly to the things that we discussed on the left-hand side of the page. Number three, staff develop and use systems to support cost claimability across all departments. Now, what might these systems be? We'll discuss a few of them later on in this session, but some examples could be having regular stand-up meetings with your supervisor to discuss how you are doing in terms of performance, being able to share job aids or tactics that you use that you feel are extremely helpful to help ensure that you are optimizing your capture of high fidelity, high integrity FFP. Number four, staff use data to identify and clearly articulate opportunities to increase federal match. Now, this one is extremely crucial in terms of the long-term sustainability of this practice. When you're able to recognize what groups are really doing well in this effort and what groups may need more support, you can use that information to your advantage to make decisions on, let's make sure that we connect program A to program B so that program B can be upskilled by all of the things that program A is currently doing that is allowing them to be so successful in this particular metric. Number five, staff reinforce the shared responsibility to enable federal match claiming across teams and functions. And so this piece is truly just holding each other accountable. It has a lot to do with number two, that ownership piece of understanding that you can truly influence what happens fiscally for the behavioral health department. But number five is being able to have that shared accountability, right? Reinforcing the behavior with your colleagues and with your coworkers to ensure that everybody is rowing in the same direction.
Just wanted to give a brief overview here of this pyramid that we have. Now, at the bottom, we have context. In the middle, we have culture, and then the top, we have purpose. And I think culture reflects the values and behaviors that occur at the bottom level, and leaders can change this context to help shape the culture. So it really does start with leadership. At the bottom, we have leadership, organizational design processes and policy, promotion and development, performance management, informal interactions, and communications. And so this is truly the foundation of being able to feed up to culture and ultimately purpose. We'll be discussing this base layer of the pyramid in depth today. So what does this base layer look like? Across these six key dimensions, leaders within a county behavioral health department can actively shape the context of their department to promote and embed desired behaviors. So what do we mean by this? It's essentially just these are the things within the realm of direct control that county leaders can influence to help promote stronger culture and stronger purpose as it regards to FFP optimization. And so these six categories: leadership, how do leaders direct focus and role model desired behaviors, org design process and policy, or the team structure and codified ways of working together that can help promote a culture of FFP, promotion and development, internal processes to educate, develop, and celebrate staff. So recognizing when staff are doing really well and being able to truly, show staff that this is something that is valued from leadership. Performance management, being able to actively track FFP related metrics, informal interactions, staff interactions outside of formal stand-ups or email communications. These are things that happen on a day-to-day basis and definitely matter in terms of being able to influence culture. And then lastly, formal communications. And so these things can be emails, formal meetings where there is a talk track and a presentation present in the room, things like that. Now, within any of these six dimensions, behavioral health leaders can shape behaviors by identifying and closing gaps that exist within four main categories: awareness, knowledge, motivation, and accountability. Now, awareness is essentially just understanding the impact multiplier effect of federal match. So, recognizing that the federal match that gets drawn down has an amplified impact that directly increases the quality of care and directly improves care for their client population. Knowledge, so understanding like the tactical things that need to be done, the actions that are required in order to optimize federal match. Motivation, so it's just the desire to go ahead and do this. And then accountability, tracking your progress, knowing when you're doing well, but knowing when there's room for improvement as well. So high performance culture will be able to recognize gaps in all of these. And when all of these four conditions are met, that is when you know that you've achieved a very strong culture as it pertains to FFP. Now, we've identified several ways that leaders can influence any of these four dimensions here. And so across this matrix, you'll notice that some of these columns associated with each of these metrics, that would be awareness, knowledge, desire, and accountability, will address a certain subset of those four. And so, for example, in the first column, promotion and development, within an FFP explainer, for example, that will address more directly awareness and knowledge versus an FFP management review would address knowledge and accountability. A pulse check survey may, exclusively address the accountability lever. And we'll dive into some examples of these later on in the session. Wanted to take some time here to walk through a sample 12-month calendar of levers to promote federal match claiming. So, as I mentioned prior at the beginning of this session, it is important to note that you can adapt this 12-month calendar as you please to fit the needs or timelines that exist within your specific county. And so, although the first month here is January and the last month here is December, if this is an initiative that needs to start March of 2027, that is totally fine. You can make adjustments to this as you see fit. But this is just a sample truly of how a county can put together a very structured approach to optimizing their culture of FFP with all of these levers that are being implemented throughout the months. And so won't spend too much time walking through this in excruciating detail, but this is just a reference that counties can use and a sample cadence of when they may roll out some of these initiatives. Now, I want to talk through a little bit more high level what each of these levers can be used for within the 12-month calendar. So, wanted to note that in the orange, those would be all staff levers. In the dark blue, those are program level levers, and then the last category, which is more of a light blue, department management levers. And so these are things that are intended for different levels of staff based on addressing the needs that we have observed within specific counties. But of course, this can all be adapted to county context. If there are certain things that exist on the all staff level that feel like they would be helpful across any other level, counties can adjust this baseline to fit the needs of their specific county. Now, walking through some of these common challenges is a helpful way to illustrate how or what it might look like in terms of the challenges that are needing to be addressed within culture. And so some common challenges that limit federal match, I'll walk through them quickly. Number one, fiscal topic is not linked to the amplification of client impact. This is something that we talked through earlier. Number two, fragmented lines of communication between fiscal and program Oftentimes, both of these departments are working very hard, but it's important to ensure that there are clear lines of communication between both of those departments. Number three, federal match is seen as a topic only fiscal should care about. Again, getting at the point of shared accountability for the overall fiscal health of a department. Number four, denials being treated as billings problem. Root causes are not actually fixed. So again, root causes can come from anywhere, but being able to address this at every staff level is extremely important to truly fix something like this. Number five, teams get lost in the data without translating it into behavior changes. So again, data is great, but being able to gain insights from data is the most important piece because that's how you leverage the data into making better decisions that will carry out your strategy for the future. Number six, FFP prioritization is viewed similarly to productivity by staff. Now, I know that this one can be a bit of a challenge, but FFP prioritization is truly just getting rewarded for or recognized for the work that is being done. And ultimately, it is for the clients. It's for the health of the department, which directly impacts the experience of the client. Number seven, the scope of services starts and finishes in front of the patient. I think this one typically is more directed towards frontline staff, but can be experienced by many staff levels. This one is truly just being able to demonstrate the benefit of you can serve more clients or we can provide more services if we are able to expand our base of funding. And number eight, policy updates are shared as memos, but they are not operationalized. This is one that we have seen to be very common and coming up with a very tactical way of dealing with, hey, here's a policy update. Here is a job aid to help remind you of this policy update. And here's an open forum to discuss. Okay, if you have questions, this is the email that you reach out to, or this is the person that you reach out to. And talking through these next couple of sections that we have for the remainder of the session, informal interactions, again, water cooler conversations or conversations that you have outside of a formal setting. Number two, communications that are formal. You can think emails. You can also think through federal match explainers, things that you'd be able to put in front of staff for them to tangibly read through and reference regularly, and then performance management. Data-driven insights, an FFP review for management, and then a pulse check survey. I'd now like to welcome us back to walking through the informal interactions section. So again, here, what are informal messages? These are real phrases that staff use at work. As I mentioned earlier, it could be a water cooler conversation, but in high performance cultures, they connect everyday behaviors to the departmental values. Now, of course, if you're walking through, what happened on your weekend, you wouldn't need to necessarily weave FFP through that conversation. But when there are conversations that happen in an informal matter, so not an official meeting and not an official communication coming via email, when you're having conversations that pertain to fiscal topics like FFP, real phrases that you use impact and drive culture from every conversation that you have. So why does this matter? It's because everyday language reflects the shared values. When you have shared values amongst staff and you talk about a certain topic in a similar way, it can help reinforce those values and it can also help introduce those values to maybe new additions to your department. Now, how can leaders apply them? Leaders will model the language, they'll repeat the language very often, and then tie it to real examples. In addition to that, when they recognize staff members for following in their lead, they will recognize that publicly. They will celebrate those instances to show that it is something valued by leadership. Now, where are these used? As I mentioned, everyday interactions, they could be something as simple as a supervisor check-in or a quick program review or an informal conversation that you're having with a colleague. It really can be used throughout any of these situations. But this is generally speaking just how we talk about FFP as a department. And what does good look like in this specific setting? Staff across teams and tenure levels will consistently use the language that reflects commitment to a desired behavior. In this instance, the desired behavior is, everyone recognizes the importance of FFP and how it ties to improving the quality of care and expanding services in the future. Wanted to talk through how senior leaders might be able to use certain phrases or certain words that can then be disseminated throughout all staff levels. And so when we talk about the ideal case, right, on the left-hand side, staff believe the mission to provide care includes unlocking funds through claiming federal match. A potential phrase that can be used would be federal match claiming is a core part of our care delivery process, right? It's a core part of the work that we do every day. Billable activities expand our impact by funding more care. To the second piece, staff understand their daily actions influence financial health and client access to services. Diligent delivery and documentation help us expand access to care. Again, tying things back to bigger picture, what does this mean? Staff develop and use systems to support claimability across all departments. Some sample phrases could be working together across teams strengthens our support systems, or enabling claimable delivery and documentation benefits all of us. Now, of course, these are just examples on the right-hand side, and I won't belabor this point too much, but it is truly important to recognize, what would work here in your county context, but then also things that you might tweak. This is purely just a baseline or an example set of things that leaders may be able to use or say in practice. But of course, leadership know their staff the best. And so being able to adapt these is truly going to make things land as best as possible. Now we can walk through what managers might sound like when talking through federal match. I won't go through all of them in detail, but perhaps we'll go through the data piece now. So, staff use data to identify and clearly articulate opportunities to increase federal match dollars. Data is a way for our program to see missed opportunities, which is definitely true, right? Sometimes it's not always super obvious, and it can come up through some rigorous analysis where you'd be able to uncover something that you may not actually have seen prior to doing that analysis. Now, what are some things that supervisors might say? So we'll go to the last column here. Staff reinforce the shared responsibility to enable federal match claiming across teams and functions. Part of my job is reminding my team to maintain a high bar. This is something that is very real in practice for supervisors. I think that, folks are always trying their hardest and doing their best, but being able to remind them that, the part of the care delivery process and part of, doing a great job in providing care is being able to optimize for things like federal match to help sustain the department. Now we'll talk through some communication strategies the county leaders can leverage. These map directly to the 12-month cadence that we had earlier in the session and will be available as a physical material that goes along with this presentation. And so important to reference that as a sample, but again, can be used at the leadership's discretion in terms of when or how frequently they'll be sending out these communications. And so would love to walk through what some of these would look like, but beforehand, really just wanted to hammer home the importance of using email to articulate clear priorities and role model desired tone. I think when it comes to email communications, it's a great thing to use in addition to verbal communications during meetings. But driving action through email requires folks to be clear about what priorities are being requested, the actions that are being requested from staff, delivering simple instructions, but also tools to help enable staff to be accomplishing the action that is desired, and then relying on deputies, managers, supervisors to follow up with staff and reinforce asks that come through these email communications, but also anchoring things to a time-bound cycle. So as I mentioned, these things are linked to that 12-month cadence, and it has been designed thoughtfully to ensure that these things fall into place in sequence. And so they're intended to be used in a way that flows from one section to another section. So it's important to anchor things on a time-bound cycle to ensure that staff understand how things will be flowing. To the middle piece here, benefits and limitations of email as a channel. So I think, email is a great thing to use in addition to other strategies, right? The audience will receive one consistent message There's no telephoning going on here. The interpretation is there, and you can go and reference the email on and on again. It's also an effective way to reinforce priorities at scale without spending too much time, scheduling things on a calendar or getting, folks in a room. But the two drawbacks could be that complex content may actually require live explanation or supplemental guidelines. And so it may be worth considering as you are rolling out some of these email communications. Ask yourself, would this be better in a live setting, or should we open up a Q&A to address any questions that may be coming from this? And lastly, the emotional tone connecting federal match to the client impact can get lost via email. And so, as I've mentioned several times already, email is a great tool to use in addition to other strategies. Lastly, here, some best practices to remember. As you are sharing out emails, sharing content aids when helpful can be really powerful in terms of providing additional context, especially as it pertains to fiscal topics like FFP, assuming it will be circulated. So this is, an important point to recognize that folks should be explicit about the intended audience, but then also the intent to serve clients, even though an email might be shared with managers only, there is a likelihood that it can get circulated to all staff. Coordinate with deputies in advance to ensure staff receive timely follow-up and support. So this is again just being able to rely on staff members that will be there on the ground to reinforce the ask and reinforce the behaviors, but then also be there to provide support for staff. Now, I won't walk through all of these email in extreme detail because there's a lot of content here, but wanted to touch on a few key points here. So, this first email, the audience would be management team. The frequency would be a one-time kickoff. The topic here is that federal match is necessary amid state and federal changes. You may want to include an FFP explainer page as an attachment in addition to office hours for folks to be able to attend and ask questions. Now, as you see things highlighted on the page, would be where we would suggest filling in county specific details. But of course, as we have mentioned throughout the session, these things can be altered and changed if there is something that would resonate more with staff along similar lines, but using different specific language. We encourage you all to make those adaptations as you all see fit. The second email here, another kickoff, but directed towards all staff once in terms of frequency again, but it's more of a broad introduction to the importance of federal match, again, with similar attachments where you would bring an FFP explainer and offer up some office hours to answer any questions that folks may have as this initiative gets rolled out. The third one here would be an annual email that comes every January addressed at management. This one can be talking about FFP forecasting and then tracking for the integrated plan in addition to the boater. These are things that are, either coming up or have already passed, depending on when you are watching this video. But of course, being able to regularly have discussions about these topics, see how things are going, and then being able to weave in a couple of metrics on how are we doing on FFP? How's the tracking going? These are, important points that can be weaved together as there are other initiatives that come up. This fourth one here coming at the beginning or just prior to every fiscal year, so annually in May. The topic here would be to finish up claims before the fiscal year close. So recognize that the fiscal year can prove to be a busy time for a lot of counties, but nevertheless, it is certainly important to be able to submit the necessary claims that fit within a particular fiscal year to optimize what counties can draw down each year. Email number 4 here, audience again directed at management annually every November, something similar, but expressing gratitude here. And so this is an example of how one might recognize, staff for working really hard and doing the right things and seeing positive change. Again, as it pertains to the highlights here, the support is available for you and your teams. Now, this is just example material. It may be the QI team, it may be the QA team, it may be its own distinct team, like a clinical standards team or something like that. But of course, whoever is available or whichever team is available to provide support as it pertains to these topics, you would switch that in and out. Email number 6 here. So this would be again towards management annually, March 2027 and onward. So an integrated plan update, things that are changing, how to prepare. This would be one where, it'd be great to include an FFP explainer, the prior year integrated plan, and then links to any DHCS or CVHDA resources. We recognize that this is going to be something new and there may be some growing pains associated with it, but being able to communicate consistently and effectively about topics that are ever changing is extremely important to, align folks on what the strategic initiative is. Email number 7 here. So this is directed at all staff. Frequency would be biannually, so April or October. And the topic can be DHCS and county TTA to support desired FFP behavior. So this for counties that have worked with collab teams in BCG before would be applicable for the projects that they focused on, resurfacing the TTA or sharing out the TTA with folks. But for counties who may be watching this video that may not have directly worked with BCG but have access to some of these materials through the internal county portal, you may be able to adjust this email to say, here are some resources that we feel may be relevant or may be helpful to folks. Then lastly here, an all staff audience every quarter to just highlight things that went well, things that we're working on each quarter, and potentially an FFP champion of the quarter. Again, this is recognizing the importance of just, saying it out loud. This team is doing a really great job, or maybe even this individual is doing a really great job. Maybe they've created their own job aid, or they have been instrumental in shifting the culture in their clinic. Things like that that come up on a quarterly basis that are important to recognize because it definitely puts a spotlight on the desired behaviors that we have discussed thus far.
So this next section is a set of FFP explainer materials that you may want to share with staff, as we referenced in the previous section when we were talking about the communications cascade that you could send via email. Some of these materials that are contained in this section may be ones that you want to include in some of those emails, or that you can share with staff members on an ad hoc basis when folks are curious about, more information regarding FFP. So this next page would just be the first sort of framing page, an overview of these materials. But as we dive in here, this first page that has content, federal match is a critical revenue source that we draw down to multiply our impact in your particular county. Now, this one is truly reiterating one of those pages that we were discussing earlier in the session, but it helps folks understand that the work that they do depends on multiple funding sources that vary by year. One of those is FFP. Now, the highlighted section is an opportunity for you to tailor this information to your particular county. But the graph on the left side is an illustrative example of how federal match can stack up against other sources like state funding, grants, or other things like that. Now, in the middle right-hand side of the page, federal match multiplies our ability to serve our community. Again, touching on that piece that we had discussed earlier, but sustaining current services amidst policy-related funding uncertainty, extremely important for folks to make that connection between FFP and the ability to do this, expanding access to more clients and ensuring high-quality service delivery. These are all things that many folks care deeply about. And when you're able to make the connection between drawing down federal financial participation dollars that you are eligible for and being able to achieve these things, it is oftentimes seen that you're able to really get folks behind the initiative of prioritizing FFP as a funding source. And so we'll get into some additional materials here on how you may explain these concepts to folks who may have not had exposure to them due to their role being outside of a fiscal department.
Federal Match 101. So this can be a page for folks that are newer or perhaps for frontline staff that consistently have questions about what federal match is or what FFP is. Three sections here, won't go too into details, but what is federal match? An explainer for that. Where do funds come from? And then which costs are eligible for federal match? This next page here explains the reimbursement process. And so the only thing to note is that step one is for contracted providers only. The rest of the steps apply for both county and contracted providers. This next piece here would just be specific criteria that needs to be met at each stage of the service delivery process for cost to be claimable under Medi-Cal. So you have categories before service, you have categories during, and then you also have categories after service. These are, modeling best practices for ensuring that things that are eligible to be claimed are in fact eligible and will be claimed. This next page here is really just highlighting no matter what role you are, everyone plays a part in ensuring that the costs are claimable. And so this touches on one of those pieces that we surfaced at the beginning of this session in saying that we have a shared responsibility, right? And so for each staff role, while I recognize that maybe not every single staff role is represented for all counties here, but for each staff category, right? Activities that may impact federal match, and then how that particular role can help increase funding for client services. This would just be the closing page to those FFP explainer materials, and you'd fill in your county name there. We've reached our second to last section here for this session, and that would be performance management. Now, what do we mean by performance management? It's essentially just leveraging data to help inform decision making going forward. So, as an objective here, because we've covered much of the context already earlier on in this session, counties can build on existing reporting requirements by leveraging this data that they will be mandated to collect, but also some additional data fields that might be useful to help identify, FFP metrics in upcoming requirements for the boater and the broader integrated plan. Building a dashboard is a great way to just aggregate all of these metrics that will be required for the boater, the integrated plan, and then also just in general, FFP performance management tracking. Lastly, connecting these metrics to impact. So, as you collect these metrics, it's great for them to, be looked at and to potentially inform decision making. But again, connecting the metrics specifically to impact is very important in the messaging to ensure that we're not just looking at the numbers, but these numbers actually tell a story and they say something. So FFP and operational data from different sources can be aggregated, right, to help inform decision making. And so if we look at this left-hand side, there are daily county operations, client access and enrollment, the direct services that are being provided by frontline staff, admin, QA, or UR claiming, fiscal ops, and admin. And that feeds into the next tier, which would be the data infrastructure and management. And so each tier acts as a gate to the next tier. The next tier would be the data infrastructure and management piece. And so you need to ensure that these daily operations are happening, right? But once those things are happening, you would then be able to start implementing things like figuring out what the FFP capture rate is, figuring out the allocation of different funding sources, right? What's grant funded? What's FFP? What's in the general fund? The funding source ledger. What are we looking like in terms of admin and QAUR claiming? How are services being distributed by aid code? And then what are some non-federal match sources as well? So once you've done the daily county operations and then you've started to implement some data infrastructure and management pieces, you'll be able to draw down some data insights, right? And so this can look like total billed services, total approved services, total FFP received from billed services, and then total SGF received, right? And so each of these layers feeds into an attribute such as for this top layer, right? Data insights can lead to quarterly reviews led by the behavioral health director or perhaps a fiscal director and their deputies by using the data and trends from the financial reports to track progress and then inform strategic action. For data infrastructure and management, ideally, staff can access these data sources to support some ad hoc analyses. So as things come up or as folks get curious, if there's potentially a special project on the books, folks can pull some of these cuts of data to help inform their decision making. And then on the bottom here, daily county operations. So managers can use insights from reporting to identify where there may need to be some improvements made on any of these attributes on the daily. Wanted to show this exhibit here without getting into too much detail. There's quite a bit of variance in terms of the maturity level across data and analytics capabilities. Some counties have full data and analytics teams. Other counties, that's a split portion of a role that already wears quite a few hats. And so while we recognize that that exists, this can be sort of a roadmap to good, great, and excellent, in addition to, why each of these dimensions matters for FFP. And so if we look from left to right here, we have all of these reporting dimensions, right? Reporting cadence, metric coverage, forecasting and planning, and so forth. And then we have an example of what that might look like from good to excellent, in addition to why that matters for FFP. And so, as you are pulling these things together, you may be able to look at why this matters for FFP to prioritize which ones are most important for your specific county context. Now, I want to walk through three main metric categories that we'll have an exhibit for in the following page. But the first of which here, funding sources. What are some potential metrics for funding sources? That could be a funding source ledger, whether it be by absolute dollar amount or percentage of the total funding. Funding allocation by program, right? This could be cut across adult system of care, children's system of care, SUD, you name it. And then also non-federal match funding. In terms of FFP capture, what are some potential metrics that you might use? FFP capture rate could be one, admin QAUR claiming could be another, and then also a reconciliation report could be useful for you in this category. Service data, what are some potential metrics here? Procedure codes, service by aid code and eligibility group, diagnoses codes, ASAM level, things like that. Now, again, these are all great examples, but if folks feel that there are other categories or other metrics that sit within these three categories, by all means, if there is sufficient appetite to go and pull those metrics, then go ahead and do that to help inform decision making in the future. Now I'll flip to this detailed page. Again, folks will be able to access the materials with this session, and so won't belabor any of the details here. But a description for each of the 9 metrics that we walked through on the previous page, in addition to what insights you may be able to draw from these metrics, and then what action you may be able to sponsor or take as a result of the insights that you get from that metric. Now, something that all counties deal with would be an 835 form, right? And if we think about the 835 form, these can actually be transformed into a monthly FFP report to track the success of initiatives, whether it just be the culture initiative or other TTA that are being implemented. Being able to use these forms and then actually turn them into a monthly report can be super helpful in terms of just monitoring how are we doing on this initiative? Are things working? Are there things that need to change? And so this is a sanitized version of an 835 form on the left-hand side, but the 835 includes many columns of data, more than is explained on this page, but you really only need 3 to create the FFP report. And so you can aggregate on a monthly basis the E35 data into a maximum allowable amount, which translates to the total billed, federal financial participation, which would be FFP received, state general funds, which would just be SGF received, and then the sum of SGF and FFP received, which would then give you total approved for that month. Now, once you've identified FFP metrics and you aggregate them, you can turn them into a dashboard for regular leadership review and decision making. Now, whether you have an enabled team that has built dashboards regularly, or you have a staff member that is inclined to use technology to their advantage, creating a dashboard like this to consistently track these metrics makes it really easy for leaders to bring up in formal meetings, but then also for them to check on a regular basis to say, hey, how are we doing on these particular metric areas? And federal match remains a core driver of our current focus and efforts. Amongst all of the changes that are happening in the state of California right now, two ways that counties can increase federal match would be one, to use data to track the progress and manage activities, to ultimately increase claiming, and then number two, execute initiatives that shape culture to promote increased federal match claiming. And so these are both topics that we've discussed at length throughout this session, but just wanted to reiterate the importance of both of them as counties march towards the future. Here's a sample slide of quarterly performance. This is something that you can use in a quarterly meeting or a quarterly email. And this is a example screenshot of what would exist on a county dashboard. So as you are reviewing, the quarterly performance, you can say it reveals if things are going well, strong, if things are going all right, mixed, and if things aren't going to plan, then weak results across key programs. Some sample questions on the right-hand side for folks to discuss during a quarterly meeting, or perhaps some of these questions could be used as prompts in a quarterly management email. Another sample here, so the status of ongoing federal match improvement initiatives, going through these staff behaviors that we had discussed at the beginning of the session, 1 through 5, asking staff management to reflect on how each program and each team have been doing in the past 3 months, right? Like, what are programs trying? What's working well as it pertains to these, 5 elements? What isn't? Any accomplishments within the program? This would be a great opportunity to raise, any rising stars or anyone who's truly doing an exemplary job. And then any challenges that the team could help brainstorm during a quarterly meeting. The last section here is a pulse check survey. Now, this is designed as a tool to help assess the elements that exist and the gaps that we are trying to close. And so if we flip through here, there are statements that are associated with those four categories, right? The awareness, the motivation that we had discussed earlier. And a pulse check survey can be administered and assessed on a Likert scale. So that goes from strongly disagree to neutral to strongly agree. And it would assess a set of statements for staff to be able to inform leadership where folks are at. This is something that could be administered at the beginning and then perhaps after a year or maybe on a more regular basis, depending on capacity, but something that can be issued in something as simple as a Google or a Microsoft form. Thank you all for the time today in learning more about this culture toolkit. Please feel free to reference the materials directly as they will be a companion to this recorded session.